pretty solidly is that because of the nature or really lack of funding for actually jumping directly into any kind of a statewide rollout program is the need to create a persuasive pilot, I guess I would call it, a pilot demonstration of several things. One of the things we want to demonstrate is that by using Department of Transportation highway resources and rights-of-way, we can actually create a model that we can demonstrate in the project of being able to construct new broadband middle mile capacity conduit for providers like the various telephone companies and cable companies to be able to use to build out middle mile access into rural areas. So that's a key component of the pilot demonstration. The second part is to demonstrate an educational transformation in some rural schools that right now have little to no access to any high capacity bandwidth. And then the next one is to demonstrate significant healthcare delivery to a rural area via telemedicine. And then the last one, of course, is to demonstrate with some kind of persuasive numbers that we have actually had impact on economic development in the rural communities that become part of the pilot. Now that's a fairly full plate of stuff to do, all in a pilot that we would like to do fairly quickly, probably in the first half of next year. We can actually get all of the forces to come together. In the conversation in this group, there's been an exploration of a lot of different kinds of options about the healthcare demonstration component of that overall pilot demonstration. Some of those things have as I'm reading them and hearing them, but I'd like the group to really take this on and discuss it, lead to focus on demonstrating things in urban markets because resources are there to be able to demonstrate healthcare delivery by telemedicine in urban markets that don't necessarily make a persuasive case